The next part of my talk will, every year somebody says, what's new, what's the latest, what's the greatest? Some of you ladies have been here before, have already seen this presentation, but we have a new thing called Ultherapy, or Ulthera. Through the years, Thermage came out. That is something that we've been offering for a few years now. It is a radio frequency energy. There's also some other technologies out there that use radio frequency. This technology is ultrasound based. So same thing as when you have a baby ultrasound or a gallbladder ultrasound, so it's very safe technology. There's no radiation, there's nothing of that sort. But what it does, it allows you to use the ultrasound in such a way to heat up below the skin and not damage the skin. The way that you create tightening of the skin is you heat it up so it naturally retracts and causing somewhat of scarring below the skin, but what it does is it tightens and pulls up. So I'll show you some pictures of that here in a second. So like I talked about before, aging face, you can have all kinds of things such as hormonal changes, sun exposure, smoking, gravity. You have the skin, you have the fibromuscular layer, and then the muscle below that. So what we want to affect here is the connective tissue below the skin without actually damaging the tissue of the skin. So how collagen works, and this will be a segue into how Kelly's talk talks about how you can do it from superficially. You need collagen to provide structure to the skin. That's the framework of the skin. So if your collagen is gone, this is where your elasticity goes away. So when the skin starts sagging down, your connective tissue is very loose and lax, and that's how you look wrinkled. So, and it first usually occurs on the forehead, brow descent like I talked about, and just goes downhill over time. So you'll see from younger to older, everything starts coming down. You'll see all kinds of flattening of the mid-cheeks, the folds, marionette lines, sagging of the chin, essentially everything we talked about. So this is what's used as ultrasound energy. So what you're trying to use is the ultrasound energy and harness that energy in a way to heat up the skin, heat up the soft tissue without damaging the skin. So how does it work? Using ultrasound energy, it's non-invasive, and you have different beams of ultrasounds that when they merge below the skin, causing heat. And you're using that type of technology, you can actually heat up the connective tissue to a much bigger degree than other technology that's out there. If you, for example, using Thermage, which Kelly will mention also, you can use that to heat up the soft tissues, but it also heats up the skin. And the skin can get burned from that. So you gotta be very careful. So you can't get a very good temperature as you would with this. So over time, you'll see what happens is the stranding of the collagen will start to fall down and you get the elasticity. So what we want to do is tighten that up and lift the skin back up. So lasers will actually work on the very superficial layers, and we want to go very deep. And we're using the ultrasound, we can actually see where we're treating it now. So before, we're just putting it on there and blindly treating it. Now we can actually physically see where the layer is we want to treat. So who is the best candidate for this? So when people come to me and I look at them and give them a consult, first of all, I say, do you need surgery or non-surgery? Now I've had patients come in, I'll say straight up, you need surgery. If I do something on you and it's not going to work, you're going to be mad at me and mad at yourself for spending the money. So if you need a facelift, I will tell you that, because that's the best thing for you and the best use of your money. I don't want to steer you the wrong direction. However, there are a lot of people that don't need a facelift but need something in between. And that's where this comes into play. So it's more of a kind of a maintenance, kind of helping tightening over the years. So we can help with that. So here's some good pictures here, from mild to extreme about the skin laxity. And this is the first technology that's been FDA approved to lift skin. Okay, so like Thermage hasn't really been FDA approved to do that. It's designed to help tighten skin, but not to lift. And that's at 90 days out for both of these. I'm sorry, can't see with the lighting here. So here's some better pictures here. You'll see before and after. That's a very good one over there, and also over here and around the eyes. So if you have a lot of wrinkles in the skin, it can help a little bit, but sometimes you need more than that to help work on the skin surface itself. That's a good one there for the eyes. So before this type of procedure came out around the eyes, pretty much all you had to do was get an eye lift. Now we can actually do that without undergoing surgery. There again, you can see that where the hooding of the eye is better. So lower face is really where it's key. And if you look on the very bottom here, this is at 3 weeks out. Already got a lifting. It looks like it's even dissolved some of the fat too. So if you get some energy there, it can help dissolve fat. And that's a man down there, so that's actually really good. You can see down there. So a lot of men will get the sagging neck skin. That'll help a lot with that. So what's involved with this? Everybody wants to know, how is this? Is it painful? Well, essentially what you do is you come in, we clean your skin, we take pictures. It takes about an hour to do the procedure. And what we do is we'll do a topical, and in some cases we'll actually do some dental blocks. So it's not like getting a simple hydrofacial or those kind of things. This is a procedure. So you might have to have a driver take you in if you need to get some Valium or something, because I mean there is some discomfort with it because it does heat up. But it doesn't interrupt you. So when you leave, there's nothing outward appearance that you've had something done. So what happens is we use the ultrasound imaging to look at where we're going to treat, deliver the energy, and that's going to help improve your collagen and get new collagen to form. So like I said, there is some discomfort. It does heat up. We have the thermoids over time, and it does give heat and energy, and it does feel hot. I mean, your skin will get really hot, but that's what we're trying to do. So every person is different. So some people can tolerate this about anything. We've done on some of my staff members, and some of them, one person is a little bit more discomforting, one sailed right through it. So it just depends on you and how you can tolerate this. And so what happens immediately right after, you're back to normal. So that's the beauty of this procedure. You can have some immediate tightening that you'll see because of the actual procedure itself. And so what kind of results you'll get? You'll start to see lifting and toning, but you might not see things for the first few weeks. And you'll look in a mirror and say, I don't see a change. That's when you come back and see us. We'll take another picture like a month out and show you the difference picture. Because you see on a daily basis, you might not see a change. For any procedure we do, we try to document that so you'll see that change. What's interesting, there's a website called realself.com. I mentioned this at the last talk. What it does, it has consumer ratings of every procedure out there. So if you go to realself.com and type in this, we did this the other day, it's the #1 ranked procedure on this website out of all the plastic surgery procedures out there. Botox, fillers, liposuction, breast jobs, everything. So the highest rating procedure, it's only been out, a few years. So to be #1, that tells you that it's actually a very good technology and people are very satisfied with it. So essentially, in summary, non-surgical, non-invasive, like anything I've talked about today. No downtime, takes about an hour. One treatment is usually all that's needed. You'll see some immediate treatments there. It's kind of all over the country right now in all these magazines. So we spoke to some plastic surgeons while we were looking at getting this, and everyone we spoke to spoke highly of this procedure. So they said they had seen some really good results.